You wouldn't share your sandwich with a stranger, but every day, millions of people unknowingly share their bodies with unwelcome guests, parasites. These tiny organisms live off us, stealing nutrients, manipulating our bodies, and sometimes even taking control. But with countless types out there, which are the real threats? We're about to expose the top 5 contenders. We'll crack the code on how they invade our bodies, uncover the havoc they wreak, and explore the science behind these nightmarish body snatchers. Number 5. Plasmodium falciparum. Ever feel achy, feverish, and like you've been struck by a shiver monster? The culprit might be malaria, a nasty disease caused by Plasmodium falciparum, a tiny parasite that travels to you on the back of an infected female Anopheles mosquito. Here's the lowdown on how it all goes down. The Anopheles mosquito is the villain in this story. When it bites someone infected with Plasmodium, the parasite hitches a ride into the mosquito's belly. There it multiplies like crazy, eventually making its way to the mosquito's salivary glands. Now, the next time this mosquito bites someone, bingo! The Plasmodium parasite gets injected right into the bloodstream of its host. Once inside, Plasmodium migrates to the liver, where it undergoes further multiplication within liver cells. This initial replication phase is clinically silent, meaning the infected individual experiences no symptoms. However, a new generation of parasites, known as merozoites, eventually burst from the liver cells and invade red blood cells. As the red blood cells rupture, the infected individual experiences chills, fever, sweating, and headache, the hallmarks of a malaria attack. The severity is directly linked to the number of infected red blood cells. Plasmodium falciparum, unlike other malaria parasites, possesses a unique ability to adhere to the inner linings of blood vessels. This sequestration, however, can obstruct blood flow to vital organs, leading to potentially life-threatening complications such as severe anemia, cerebral malaria affecting the brain, and acute respiratory distress syndrome. The good news is that malaria is treatable. If you think you might be infected, see a doctor right away. They can do a quick test to check for Plasmodium and prescribe medication to kill the parasite. Early diagnosis and treatment are key to preventing serious complications. Here's the not-so-fun part. Plasmodium falciparum is the trickiest type of malaria parasite. It's become increasingly resistant to some medications, making it more challenging to treat. That's why preventing mosquito bites in the first place is crucial. So how do you avoid becoming a buffet for Plasmodium? If you're traveling to an area with malaria, use insect repellent with DEET and wear long sleeves and pants, especially at dusk and dawn when mosquitoes are most active. Sleeping under a mosquito net treated with insecticide adds another layer of protection. Number 4. Trypanosoma brucei. Up next is the Trypanosoma brucei, a species of parasitic kinetoplastid from sub-Saharan Africa, known to cause sleeping sickness, a disease affecting both humans and animals in the area. However, unlike malaria, which transmits through mosquitoes, Trypanosoma brucei relies on the tsetse fly as its primary mode of transportation. These blood-sucking insects act as unwitting vectors, picking up the parasite while feeding on infected individuals and subsequently passing it on to healthy ones through their bites. The initial stages of Trypanosoma brucei infection can be deceivingly mild. Flu-like symptoms like fever, headaches, and fatigue are common, mimicking other illnesses. However, the parasite doesn't stop there. Left untreated, it embarks on a more sinister journey, invading the central nervous system, the body's command center for all things thought, movement, and sensation. This is where the disease earns its unsettling nickname. As the parasite disrupts the nervous system, daytime sleepiness becomes progressively more pronounced, accompanied by slurred speech and confusion. If left unchecked, this sleepiness can intensify to a point of coma. Fortunately, African sleeping sickness is treatable, especially if diagnosed early. Medical professionals can utilize a simple blood test to detect the parasite and prescribe medications specifically designed to eliminate it. Early intervention is crucial to prevent the irreversible damage. Prevention, however, remains the most effective strategy. Number 3. Leishmania. Picture this, you're on a fantastic vacation in a tropical paradise. Sunshine, beaches, maybe even a tempting plate of exotic street food. Sounds idyllic, right? But lurking in these warm, sunny places is a tiny enemy, the Leishmania parasite. You can't see them, But these microscopic hitchhikers hitch a ride on sandflies, almost invisible insects that buzz around at dusk and dawn. And their bite packs a nasty punch, leishmaniasis. Don't panic yet. While leishmaniasis sounds serious, it can actually show up in a few different ways, depending on the type of leishmania you encounter. The most common form is like a souvenir you wouldn't want, a stubborn skin sore. It usually starts weeks or even months after a sandfly bite, as a small bump that grows into a crater-like ulcer. It might be painless, but it can be quite large and leave a permanent scar. But leishmaniasis can also take a more serious turn, venturing beyond the skin. This is called visceral leishmaniasis, and it targets your internal organs, especially the spleen and liver. Here, the symptoms are more like a bad case of the flu: fever, chills, fatigue, and weight loss. If not treated in a timely manner, it can result in death in more than 90% of cases. Furthermore, most cases occur in Brazil, East Africa, and India. Public health efforts aimed at controlling sandfly populations and individual preventative measures are essential for reducing the overall disease burden on leishmania endemic regions. Travelers to these areas should take precautions to avoid sandfly bites. Number 2. Filarial worms. What happens when some microscopic squatters take over your body's drainage system? This unsettling reality becomes a chilling truth for millions infected with filarial worms, a parasite causing lymphatic filariasis. But how do these freeloaders even get in? The story starts with an infected mosquito. When it bites you, microscopic filarial larvae hitch a ride into your bloodstream. These larvae mature over time, eventually becoming adult worms that settle comfortably, for them, not you, in your lymph nodes and vessels. Here's the bad news. Their presence disrupts the normal flow of lymph fluid, leading to a buildup and nasty symptoms. The most common sign of filarial worm infestation is lymphedema, the scientific term for swelling in your arms, legs, or genitals. This happens because the lymphatic system can't drain fluid properly. In severe cases, this swelling can be extreme, leading to a condition called elephantiasis, where affected limbs become grotesquely enlarged and disfigured. Not exactly a pretty picture. The good news? Filarial worm infections are treatable. Doctors typically use medication to kill the adult worms and prevent further multiplication. The bad news? The damage already done, like lymphedema, might not be completely reversible. Early diagnosis and treatment can significantly improve symptoms and prevent further complications, though. Number 1. Naegleria fowleri. Last but not least is Naegleria fowleri. Now, the name itself might sound like a made-up villain from a sci-fi movie, but this single-celled organism is a very real threat lurking in warm freshwater. Affectionately nicknamed the brain-eating amoeba, Naegleria fowleri causes a rare and devastating disease known as primary amoebic meningoencephalitis, PAM. PAM is a mouthful, but it essentially means an inflammation of the brain and meninges, the protective membrane surrounding the brain caused by an amoeba. Sounds scary, right? It is. Symptoms of PAM typically appear within a week of infection and progress rapidly. Headaches, fever, nausea, and vomiting might seem like a bad case of the flu initially, but things take a turn for the worse quickly. Confusion, seizures, and even coma can occur as Naegleria fowleri wreaks havoc in the brain. Left untreated, PAM is almost always fatal. Thankfully, Naegleria fowleri infections are extremely rare, with only a handful of cases reported each year. However, due to the rapid progression of symptoms and the high mortality rate, early diagnosis and treatment are crucial. Doctors typically rely on a combination of tests like spinal taps and scans to diagnose PAM. Medications are available to fight the amoeba, but their effectiveness hinges on catching the infection early. So how do you avoid becoming a host for this unwelcome guest? Naegleria fowleri thrives in warm freshwater environments like lakes, rivers, and poorly maintained pools. The best way to avoid infection is to simply steer clear of these areas, especially during hot weather when the amoeba is most active. If you must take a dip, consider using a nose clip to minimize the risk of contaminated water entering your nasal cavity. If you liked the video, please consider subscribing and sharing so we can keep bringing more content like this. See you next time!